Would you define yourself as a power woman?
Oh my gosh, that's I don't know. That's a tough one.
Answer all the questions now and then. Now you're like, oh
I
my
know.
gosh.
Oh, I know. Oh my goodness.
Inception of the business. You're in a very male-dominated sort of sector, right? And that beginning must have looked very tough. Speak to us about that.
Geez. So the inspiration actually came when I was still a student in Cambridge. What I actually saw is that there were a lot of technologies, and students were coming up with really innovative technologies using the internet and mobile technologies, and especially in healthcare using AI to solve for cancer genomics and the likes. And I found that very fascinating. But when I had a look at what's actually happening, is that none of the diseases that they were focusing on were central to Africa. So for example, like TB, HIV, things that were really like quite pressing in our time. So that is where I saw that, look, I can use these technologies that they're using and try to retrofit for the African context. So being able to use like data analytics for like HIV, cancer, TB and the likes. And that's actually where the business basically came to a start. But one thing I also did really struggle with, especially in the beginning, was just access to health data for us to be able to do the work that we do with AI and etc. So we literally had to start from scratch and start now building up that repository of health data so that we can now understand what's actually happening on the continent.
And also the time you started, AI was still sort of like that minuscule, theory, right?
You're so right. Can I tell you, people actually thought they didn't understand. I was like, oh, how about we use AI, genetics and genomics? It was like I'm speaking to, exactly. So it really took a while, and only now, I think, when we started first thinking about this was over 10 years ago, only now has it become like a buzzword, like, oh, okay, health data analytics, AI, genomics, and we can do all these things, put them together and get some really cool insights. So it took a while. So I do feel like I was slightly ahead of my time in terms of my thinking, which was a bit of a disadvantage because, I was speaking about all these things and, it wasn't really landing. But now, we've progressed quite significantly and people understand and they're like, okay, this is really a niche industry that we can go into and really try and improve health outcomes in Africa using health data.